Hello everyone, my name is Deja White and I will be talking about tuberculosis, and it's going to be totally tubular. Tuberculosis, also referred to as TB, is an infectious bacterial disease that primarily affects the lungs. TB is spread through airborne transmission from one person to another. People nearby may breathe in the bacteria and become infected. This is called active TB. However, not everyone infected with the TB becomes sick. This is called latent TB. Some people are asymptomatic for TB and still have the infection. These people are carriers and can still spread the disease to other people. Okay, so to start off, I'm going to give you guys some background information about tuberculosis. TB was discovered in 1882 by Dr. Robert Koch, who is pictured right here. He confirmed that this disease was not hereditary, but an infectious bacteria. Tuberculosis, TB, is a disease caused by bacteria called Mycobacterium tuberculosis, which is shown in the image right next to Dr. Koch. This is a red rod-shaped bacterium. Tuberculosis is highly aerobic, which means that it requires oxygen to grow. It is not determined whether it is gram-negative or positive because of the high lipid content in its cell wall, so acid-fast staining is used instead. The acid-fast stain is positive if the patient has TB. TB does not grow in environments where there is low pH, low oxygen, and high fatty acid levels. The bacteria usually attacks the lungs, but TB can attack any part of the body, such as the kidney, spine, and brain. When someone breathes in the TB bacteria, the bacteria can reside in the lungs and begin binary fission, which, if you don't know, is how bacteria replicates. Then, it can spread via blood to the other parts of the body. TB can be a fatal disease if not treated properly or in time. At one point in the mid-1940s, TB had killed 1 of 7 people. The rate of tuberculosis has decreased from 52.6% in 1953 to 2.7% in 2019. There is estimated to be about 13 million people in the United States that has tuberculosis. Although that seems like a really high number, it is not. The US has one of the lowest rates of TB in the world. This is due to the US being a first world country and having advanced medical facilities, as well as access to medicine for treatment. Starting in 1940s, scientists discovered the first of several medicines now used to treat TB. As a result, tuberculosis began to decrease in the United States. But in the late 70s and early 80s, TB began to spike again, probably due to the rising HIV cases. And you're probably wondering, what does tuberculosis have to do with HIV? Well, HIV causes people to have a low immune system, and that is where tuberculosis thrives. This led to an increase in the number of tuberculosis cases between 1985 and 1992. Since then, there has been a steady decline in the number of people with TB since 1993. Globally, men are significantly more at risk of getting and dying from TB than women. In 2017, almost 6 million men contracted TB and around 800,000 died from it, compared to about 3.2 million women who got the disease and only 400,000 died from it. Although the mortality rate is fairly low, TB was once the leading cause of death in the US and is one of the top 10 leading causes of death by infectious disease in the US today. TB is uncommon in children 5 to 15 years old. The population at risk for developing TB are infants and toddlers, people who have weak immune systems, and people over the age of 65. This population of people have a lower chance of recovering from this disease and require more attention. The percentage of TB cases that occur in Hispanic, African American, and Asian people are higher than the percentage of the same minorities in the U.S. population. In 2019, about 88% of the tuberculosis cases reported in the U.S. occurred among minority groups. People are more susceptible to TB if you work in a hospital, have HIV, are a smoker, and have traveled to places where tuberculosis is common, such as countries in Southeast Asia and Africa. Some of the signs and symptoms associated with tuberculosis are pain in the chest or pain while breathing, chronic coughing. Sometimes the coughing can contain blood, and coughing usually lasts for over 3 weeks. There are chills, fever, fatigue, loss of appetite, sweating, swollen lymph nodes, and shortness of breath. Most people infected with tuberculosis don't have all of these symptoms, but when the symptoms do occur, they usually include coughing. But there are so many infections that result in chronic coughing that tuberculosis is often misdiagnosed at first. Tuberculosis is treated with antibiotics. Isoniazid, INH, is the primary medication used to treat tuberculosis. It is usually given with rifampin, pyrazinamide, and ethambutol. People may begin to feel better after a few weeks of taking the medication, but TB takes longer to get rid of than other bacterial infections because it grows at a slower rate. Treatment may vary depending on if the patient has latent or active TB. If the patient has latent TB, the doctor may prescribe the first line of antibiotic drugs to kill the bacteria so the infection doesn't become active. They would have to take this drug for up to 9 months. The same combination of drugs can also be used to treat active TB. If the TB becomes drug resistant, the doctor may prescribe the second line of drugs that have to be taken longer, for up to about 30 months. It is important to finish taking all of the medication even when there are no signs or symptoms. If not, the bacteria can become resistant to the drugs. Treatment in the U.S. works for over 95% of the tuberculosis cases. If a person is found to be infected with TB bacteria, other tests are done to see if the person has latent TB or active TB. There are 2 kinds of tests that are used to detect TB bacteria in the body: the tuberculosis skin test and the tuberculosis blood test. In the skin test, a doctor injects the patient with a small amount of fluid in the skin of the lower arm. After about 2 days, the doctor checks for swelling in the arm. If the results are positive, you probably have tuberculosis bacteria, but there could also be a false positive. That is why this test can be repeated multiple times to ensure that the results are accurate. The blood test measures the tuberculosis proteins that are mixed in with a small amount of the patient's blood. A positive tuberculosis skin test or blood test will tell that a person has been infected with TB bacteria. It does not tell whether the person has latent or active TB. Other tests, such as the X-ray test and the acid fast test, are needed to see whether the person has the active tuberculosis disease. The diagnosis is usually determined by a pulmonologist, primary care doctor, or an infectious disease doctor. Last but not least, some fun facts about TB are that it is the leading cause of death in people that have HIV, and tuberculosis is often misdiagnosed as pneumonia. That is why it is so important to do the acid fast, blood and skin tests, and the X-rays in order to confirm the disease. Finally, here are the resources that I use to find all of my information. Thank you.